Bismillah ar-Rahman ar-Rahim. Today we're going to be explaining the airway resistance. Okay, let's start. So, airway resistance. Basically, air flows because of the pressure difference from the mouth to the alveoli. Resistance depends on what? Depends on the gas, viscosity, and most importantly, it depends on the radius, especially the radius اللي هو to the power of 4. You see that? So the doctor has mentioned that a small radius, like a small change in radius, can cause a bigger impact because it's to the power of 4. Okay? That's why small bronchial constrictions as asthma makes a massive increase in the resistance. Okay? So that's literally what he said. He said that this is the alveolar space, okay? And as we're going out to the mouth, okay, you don't need like to know all of these, even though like he mentioned it. He said that the PAO is the pressure at the airway opening, okay? It means this is the mouth. Just imagine that this is the mouth and this is the neck and this is the lungs, okay? So he mentioned that the space at the lung is so huge to the point where we don't have any much resistance, okay? But when we go from the airway going out to the trachea, okay, it gets smaller and smaller by the diameter, which makes a resistance. Basically, you're driving here and then boom, you hit a stop because the road is short, okay? So you have to slow before making a turn. Tamam? This is the explanation of it. Okay. What about this slide? Think of the airway tree as an early branches, okay? As a what? As an early branches, but larger one. Let's say that the later branches are made by tiny peripheral airways, contains most of the lung volume, which lowers their total resistance despite each being narrow. يعني وش الكلام هذا? What did he mean by that? Basically, he said that these are the distance, okay? Let's start from distance number 16, okay? He said that we are having a higher volume at these, okay, from the 20 till the 16, and then since we're going through the dead space, we're having a what? We're having a lower volumes. Okay? Okay, this slide is very, very, very important. It may come in the exam or it may like have the idea. And it also confused me for a bit because I was thinking that when I read the slides, I thought that the bigger the radius, the lower the resistance. So when the doctor explained and started explaining where we were talking about the segmental bronchiole, this is from the beginning, right? This is when we inhale it from the mouth and then it goes up, and then when it goes to the alveoli and it goes to the segments and branches, it goes lower. So I was like, how? Since the alveoli has such a small radius, it should be higher, isn't it? لا في a twist. Because let's say that this is your trachea, right? Let's draw it. This is the trachea, okay? This is the diameter of the trachea. You're gonna be thinking, oh, it's big. It doesn't have any resistance. Well, it does. You know why? Because since we're going down, we're branching and branching and branching and branching even more, right? So those little branches, the terminal bronchioles, okay? If you add them up, if you sum all of the radius, it's gonna be 10 times, even 50 times bigger than the trachea itself. So you're gonna have a lower resistance, okay? So when he says, where is the higher resistance? It's gonna be in the beginning when we inhale the air. See here what they said? The major side of resistance in the upper airways is 80%. So we have a resistance, 80% of resistance, and then is in the airways. Now you know why? Okay, so just think of it as the bigger picture. Don't complicate yourself. It's not that much complicated. Basically, pulmonary, and especially this lecture, is so easy and so fast. Tamam? Same way here. Okay? Same way what? Here. We're saying that the higher the higher the resistance, okay, it begins from the beginning. And then since we're segmenting, okay, and we're branching here, the diameter goes more. Since the diameter goes more, we have a lower resistance. Okay? See here, it says the distribution of the airways we have the 30 trees, okay? And then the major site that has 80% is the upper one, the upper airways. I think this info is important, kind of important, because he may or may not bring a question about it, okay? Factors that affect the airway resistance. What are they? There are a lot of factors. We have the 5 factors: density and viscosity, right? Yeah, density and viscosity, okay? Let's say that resistance isn't fixed. It depends on the gas, which is denser, harder to move, or the chemistry. We have a low carbon dioxide, which narrows our airways, nerves and hormones, like the B2, that relax, and the acetylcholine, which makes us constrict, and we have the lung volume. Bigger lungs pull airway open. Okay, so these are the 5 ones. Do we need to memorize them? Well, you do, but you have to focus on the lung volume, because as you can see down here, he explained more about the lung volume, about the recoil, about the elasticity. See, the lung volume. يعني هذه it's not a coincidence, isn't it? تمام. We had to stop because of the prayer. المهم, expanding the airways by elastic recoil of the lung tissue. So think with me. Airways are embedded in the lung tissue. هذا أول شيء. When lungs expand, the tissue recoil. زي like the spring. شايفين السبرينج اللي هنا? Okay? So it recoils and pulls open small airways. So it raises the lung volume, diluting these airways passively. ممتاز, يعني تاخذ مساحة أكبر. Here it's explained. شايفين? We said the lung volume. Okay, factors influencing the airway resistance اللي هو the lung volume. The higher the lung volume, the lower the resistance will be. So we have a higher lung volume, the lower the RW will be. Okay, so the bronchi and the bronchioles are residing with the lung. يعني what does he mean? الcurve هنا it shows إنه low lung volumes means a higher resistance. Okay, just a correction. Low lung volumes means a higher resistance. Okay, yeah. And higher volumes means lower resistance, because the lung recoils and open the airways. Okay, let's go to the other one. The key concept هنا. The key concept is like when you see a key concept, it doesn't mean like it's an objective ولا شيء. No, it's basically a summary, short summary. It means that the small changes that we make in the radius matter a lot. Both tissue force and the smooth muscle control the radius. The higher lung volumes, okay, the lower the resistance. And the big chunk of resistance is always central. تمام? So the radius is the most important one. We always talk about the radius when we're talking about the airway resistance. Okay, so I have attached few questions that are in the practice questions. Let's say question 6, okay, to show you how important are the factors, because إذا يبغى يجيب أسئلة بيقدر يجيب أسئلة على الفاكتورز. okay, لأنه يقدر يسوي derivations بشكل مو طبيعي. طيب, we have a 5-year-old man with a 30-pack year smoking history. Presents to his physician because of 3 months history of productive cough. He's diagnosed with chronic obstructive pulmonary disease after an X-ray on the chest demonstrating hyperinflated lungs and flattened diaphragm. ما علينا من كل هالكلام. تعال نشوف most important thing. The physician prescribes inhaling steroids اللي هو B2 agonist, okay, and المهمة, تمام. فيقول لك this produce the bronchodilation. تركز معي بالكلمة هذه, أهم كلمة بالسؤال كله. bronchodilation, توسع في إيش؟ في الشعب الهوائية. through which of the following mechanism? Just to understand, لو تلاحظ هنا we have the agents, okay, that affects the airway resistance. لاحظ أنا قال affecting the airway resistance, ما قال it helps. فأول ما أشوف كلمة acetylcholine I directly know that it's A. Why? Because blocking of the acetylcholine at the muscarinic receptor. تعال نشوف هنا. Okay. فيقول لك this medication اللي هو لوبرتوم bromide is a muscarinic antagonist used to treat ايش؟ asthma. Okay, like the inhaler. It competitively blocks the muscarinic receptors preventing acetylcholine. So acetylcholine هو ايش؟ The problem because it says هنا it's affecting the airway resistance. Let's see the other question. A 26 years old farmer works presents to the emergency department with a diarrhea, vomiting, bradycardia and diaphoresis, yes, هاتر في كل شيء, and severe respiratory distress. History reveals acute exposure to malathion and organophosphate while working on the fields 4 ساعات prior to that. Okay, which of the following is responsible for his severe respiratory distress? تعال لاحظ وفكر معي. قلنا ايش؟ قلنا عندنا الدنسيتي والفيسكوسيتي، عندنا الريدكشن اوف CO2 وعندنا الفوليومز، شرحنا الفوليومز وشرحنا هذولا برضو ممكن يجي اي واحد منهم، وعندك السمباثيك والباراسمباثيك. جوابنا هنا راح يكون ايه اللي هو increasing the parasympathetic stimulation، لانه كل ما زدنا الباراسمباثيك stimulation هو راح يخف، راح يقعد، راح يرتاح. عرفت؟ ف his lungs والالفيولايز والبرونكيلز كل هذول ما قاعد يشتغلوا. plus he has a bradycardia. هذا شيء مرة عجيب أعطاك إياه. bradycardia means he has a low heart rate. Okay, يعني this is one of the clue keys that can give you in a question. Okay, so always think about that. He has a lot of distress. Increasing the parasympathetic stimulation is causing these stresses. ما قال لك he needs the solution. لأنه إذا he needs the solution we decrease the parasympathetic or increase the sympathetic. Okay, but if he asked the reason means increasing the parasympathetic stimulation.